Hi, I'm Karthik, your host for today. I'm standing in front of Manipal Hospital's old airport road, one of the oldest and most trusted hospitals in Karnataka. Well, we have Dr. Fahad with us, our renal transplant surgeon and nephrologist. Doctor, can you take us through what's unique and what's really happening new in terms of in the nephrology department of Manipal Hospital, Old Airport Road? We've also read about ABO and compatible transplant, APO transplant. What is it about, and what is so unique about it?
So lately we have seen that the number of transplants across the state is increasing, and Manipal Hospital, Old Airport Road, being a quaternary care center, tries to bridge the gap in this with respect to transplant, and we are trying to do challenging transplants, especially ABO incompatible transplants. So we know that based on blood groups, O is a universal donor, AB is a universal recipient, and A blood group can give a kidney to A blood group, B can give to B. But sometimes you have relatives who are willing to donate but are not of a compatible blood group. So that is called an ABO incompatible transplant. So the anti-A or anti-B antibodies that the patient potentially has, we have methods called plasma exchange or double filtration plasmapheresis or immunoadsorption, which we can use to remove and get rid of these antibodies and increase the success rate of these ABO incompatible transplants.
So, doctor, how ABO incompatible transplants, do we have the same success rate as normal transplants?
So ABO incompatible, during the first month, the chances of rejection are higher compared to an ABO compatible transplant, but after this critical phase, the outcomes of ABO incompatible and compatible transplant are the same. There is also something called swap transplant. So if we have two pairs which are ABO incompatible with each other, we try to match both these pairs so that it's a win-win situation for both the families, where the donor of one pair gives it to the recipient of the other, and likewise for the other pair. So we have done quite a few swap transplants at Manipal hospitals, and the plan is, or the idea is, that even if we have an ABO incompatible transplant pair, we try to find another pair where both can enter into a swap program.
Doctor, talking about transplants, so there's a lot of hesitation still remaining among people to take up transplants. So what is the message that you want to give to people?
I think the message out there to all chronic kidney disease patients on dialysis would be that they should understand that the best quality of life is ensured with a successful transplant rather than being on dialysis long term. And it is important for us to educate the relatives of the family about kidney donation, and many people have certain misconceptions that donation can also shorten your life, but that's not so. We've had enough and more studies to show that the quality of life of a donor after transplant remains the same as that of a normal person. So I guess educating the people, both the donor as well as the recipient, would be the message for the season and this World Kidney Day.
Thank you very much, sir.